This is alteration in musculoskeletal function, and fibromyalgia is a chronic musculoskeletal syndrome. It tends to affect females 80 to 90% of the time between the ages of 30 and 50, and there is a figure on page 1028 that shows it. Symptoms are chronic pain, tenderness, increased sensation to touch. 50% of the patients will have headache, irritable bowel syndrome, cold sensitivity. They'll have fatigue that is profound. Sometimes it's so severe they cannot even get out of bed. Their sleep will be disturbed. They'll have pain and burning and gnawing in nature. 75% become depressed. Anxiety is another symptom. The cause they think is due to a decrease in ATP, adenosine triphosphate, adenosine diphosphate, or ADP, or an increase in AMP, adenosine monophosphate, and in substance P, which is a neurotransmitter. There is no inflammation with fibromyalgia. These are showing some of the fibromyalgia trigger points. These are tender points that are specific sites on the body that cause pain when pressed. The pain may spread when a tender point is pressed and causes pain in a larger area, for example down the leg, the arm, or the back. There are 9 pairs of tender points. Each pair has 1 point on each side of the body for a total of 18 points. These pairs are located at the back of the neck behind the ear, where the neck muscles attach to the base of the skull, about halfway between the base of the neck and the tip of the shoulder, at the spot where the back muscles attach to the shoulder blade, on front of the neck above the collarbone, just to the right and left of the breastbone, which is the sternum, about 2 inches or 5 centimeters below the collarbone, on each forearm just below and to the side of the crease of the elbow, just above and to the outside of each buttock, on each outer upper leg just behind the bony part of the hip. This point's easier to find when you're standing up. On the inside of each knee. For a clear diagnosis of fibromyalgia, according to the American College of Rheumatology guidelines, a person must have pain at 11 or more of the 18 tender points. In practice, however, many people have fibromyalgia with fewer than 11 tender points. Experts call these tender points, but you may also hear them called trigger points. Periodic paralysis is you have a muscle membrane that's unresponsive to neural stimuli. It's triggered by exercise, increased potassium levels. It's inherited in an autosomal dominant fashion, and it causes flaccid and weak muscles. Myositis is an inflammatory changes that are due to infection. They think the flu may be a type of myositis. You will have an elevated creatine kinase, and you'll have severe pain, rash, muscle stiffness, aches, and pain. Musculoskeletal tumors, a bone tumor, is an osteosarcoma. This tends to occur in men twice as often as it does in female. An osteosarcoma is 38% of all bone tumors, and 60% of these occur under the age of 20. A bone-forming tumor with an osteosarcoma is a bone-forming tumor with sarcomatous tissue. It contains osteoid tissue and a callus. You'll have malignant tumor that's found in the bone marrow. The borders of the tumor will merge into the normal bone. It usually is in the long bones. Symptoms are pain, swelling that's greater at night and can actually cause a fracture. A chondrogenic tumor, or chondrosarcoma, is a cartilage-forming tumor. It's a large, ill-defined malignant tumor that occurs in the long bone or in the pelvis and tends to occur between ages 50 and 70 most often. Symptoms are insidious. It kind of sneaks up on the person. You'll have local swelling and pain. The pain is intermittent, but it may awaken them during the night. A collagenic tumor is a fibrosarcoma. This produces fibrous connective tissue and in the metaphyseal region of the femur or the tibia. It begins in the marrow of the bone. It also has an insidious onset. It will cause local tenderness, a palpable mass with pain and swelling, and a decrease in their range of motion. A myelogenic tumor originates from the bone marrow. This is a giant cell tumor, and it causes extensive bone resorption. It's located in the epiphyses in the femur, the tibia, the radius, or the humerus. It grows very slowly. It has a low rate of metastasis, but a high reoccurrence rate. And because of that high reoccurrence rate, it may require amputation in order to treat. Symptoms are pain, swelling, and a decrease in movement. A myeloma is a neoplastic infiltration of your plasma cells, or a B-cell tumor. It causes cortical and medullary bone breakdown, infiltrating the bone marrow. It tends to be males more than females, over the age of 40, blacks more than whites. Symptoms are pain, low back, upper spine, pelvis, ribs, and sternum. It causes aching that's intermittent. It's greater with weight bearing initially. You'll have fatigue, weakness, weight loss, and anorexia. It has a very poor prognosis. Muscle tumor or rhabdomyosarcoma is a highly malignant tumor of your striated muscle. It metastasizes very rapidly. There are 3 types: pleomorphic or spindle cell type, which is the most highly malignant form, and your embryonal tumor, which is in childhood. It's primarily the head, the neck, and the GU tract. Congenital defects. A club foot is where the forefoot is adducted and supinated. The heel inwardly deviated and pointing down. There are 3 types: positional, idiopathic, and teratologic. You want to see the table on page 1072 for definitions of adducted and supinated and the other terms that are used here. Idiopathic clubfoot tends to occur more in males than females and can be surgically corrected. Teratologic clubfoot is due to another syndrome. Developmental dysplasia of the hip is an imperfect development of the hip joint. There are types that are idiopathic or teratologic, which again is due to another syndrome, and it can develop later in the infant period. It's often difficult to treat and often requires surgical intervention. And this is showing a clubfoot on the left and dysplastic or dislocated hip on the right. The dysplasia of the hip usually is on the left side only, tends to be more in girls, those who have a family history, breech delivery, or have oligohydramnios, which is a low intrauterine fluid during development. The majority of dysplasia of the hip is idiopathic. And this is showing again developmental dysplasia of the hip, malformation, the sign that you look at, the click, shortening of the leg. Osteochondrosis, chondroses, cause partial loss of the blood supply and death of the bone. It's progressive bony weakness and microfracture. There are 2 different types on this slide. Leg calvaeperthes disease, which is 5 times greater in children exposed to passive smoke. Takes 2 to 4 years to heal. Affects children between the ages of 3 and 10. Boys are 5 times greater than girls. It tends to be more so in the Northern European and Japanese area cultures, and not so often in blacks. It's often preceded by trauma. Symptoms are limp, pain that is referred to the knee, inner thigh, and groin. It is relieved with rest, spasm on the rotation of the hip, limited internal rotation and abduction, hip flexion deformity. It causes an abnormal gait and can cause atrophy of the hip and the thigh muscles. Osgood-Schlatter disease affects the tubercle of the tibia and the associated patella tendinitis. The mildest form causes ischemic necrosis in the region of the bony tibial tubercle. It affects pre-adolescent and adolescents who participate in sports, so therefore boys more than girls. Symptoms are pain and swelling around the patellar tendon and the tibial tubercle. The pain is worse after exercise. It takes about 16 weeks to heal to a point where the child can resume exercise and sports, but it does resolve with skeletal maturity. So they do grow out of it. Scoliosis is idiopathic in 80% of the cases. It does have, they think, a genetic component. It can be congenital or due to another problem, teratologic. Side-to-side curve with rotation of the spine is what occurs. 98% apex at the right thoracic. If it's greater than 25% curve, it requires a brace early on to prevent it. And this is showing scoliosis that develops and continues over time to get worse. It will affect your breathing, and it does sometimes require surgical intervention, but it also can be done with physical therapy. My little sis, when I went to nursing school, we had a big sis who was an upperclassman who helped guide us, and we had a little sis whom we helped guide. My little sis had severe scoliosis. When she started the nursing program, she looked like the third figure from the left, and she was only 4'8", and she had already had 13 surgeries on her back to correct the scoliosis. She did become an RN, and was quite a good one from what I've heard. This is a list of postural abnormalities. It gives you the name, their description, the possible cause, and the treatment. I thought you might enjoy having that. It's a nice table that puts it all together. It's from another textbook. Duchenne muscular dystrophy, we talked about when we talked about genetic disorders. It is caused by mutations in the dystrophin gene on the shorter arm of the X chromosome. As it's on the X chromosome, it only affects boys. It occurs in one out of 3,500 births, if you remember. It's usually identified by age 3. They'll have diminished muscle bulk with interstitial fibrosis of the connective tissue and fat replacing your muscle fibers. You'll have slow motor development, trouble walking, sitting, and standing. They'll fall a lot and have a waddling gait. Gower's sign is the method that they rise from the floor by climbing the legs of the chair. Talipes equinovarus of the foot is where they'll walk on the tips of their toes. You'll have decreased deep tendon reflexes and contractures will form. Scoliosis occurs, and they're usually unable to walk by the age of 8 to 10. 25% of children with Duchenne muscular dystrophy will survive to age 21. Usually death is due to pulmonary or cardiac weakness. And this is showing Duchenne muscular dystrophy, and Gower's sign and the waddling gait, and look at that. You'll see these children on the Jerry Lewis telethon. They're usually the poster children. Malignant bone tumors in children are osteosarcomas. They originate in the bone producing mesenchymal cells. They're located in the metaphyses of the long bones. And they're more so in the distal femur, the proximal tibia, the proximal humerus. They're a bulky tumor that extends into soft tissue. Oftentimes you'll have metastasis to the lung. Symptoms are pain that's worse at night, swelling, warmth, and redness. It can cause a pathologic fracture. You'll have a genetic connection after ionizing radiation. Tends to be more so between ages 10 and 25. And finally, Ewing sarcoma, which is the most lethal of bone tumors, of malignant bone tumors. Ages 5 to 15, males more than females. Mainly the midshaft of the long bones or in your flat bones, like your femur, your pelvis, and your humerus. It appears as a permeative, in other words, it's spreading out, destructive lesion on X-ray. Metastasizes early and everywhere. Symptoms are soft tissue mass, pain, fever, malaise, and anorexia. The prognosis is less than 40% if metastasis is present. And that finishes your musculoskeletal lecture.